Hi, I'm Dr. Rajani. Thanks for joining me for Raji's Quick Clip. We're talking threads. A lot of people know them as PDO or the thread lift or just facial threads. I'm going to tell you an important feature of threads, the different types, in a Raji's Quick Clip. We're going to make it a super quick one today, but it's important to know because when people said, I had the thread lift or I had threads done or I didn't like them or I loved them, it's important to know a thread isn't a thread, isn't a thread. Meaning you have to know what type of thread was used and your provider will know. It's something you can ask them. Let's talk about what are the threads that you might want to choose. Let's get this started in 3 seconds. Okay, so remember to subscribe and hit the like button for this video if you liked it. It's important for our metrics and helps us grow. Now the threads, the thread lift, the cat eye, facial slimming, smooth threads, whatever it is you were talking about, it's important to know what was used. Just like facial fillers, just like your Botox and Botox-like products. A user, a follower here, asked the question, hey, I felt a snap and my thread from 15 years ago popped. That's a permanent thread. That's polypropylene, still used in some countries, but imagine a permanent thread trying to lift the face when it's changing in bone, in muscle, in fat, in strength. It's very difficult, and so they cause puckering, and over time they didn't look right. 50% of people were happy with them. Thus, in this country, taken off the market. In many countries they still do exist, so it's possible. But those type of threads are not what 99% of people are talking about when they talk about threads. So that's polypropylene, that's permanent, that's number one. Number two, PDO, polydioxanone. This is found in sutures that dissolve. They dissolve typically after a month to 3. The results last 6 to 12 months. They build mainly type 1 collagen, maybe a bit of high hyaluronic acid. They're the most commonly used in Canada and the USA now. Why is that? A, they were the first ones to come. B, if people don't like the result, they dissolve. They do need to be repeated like all the resorbable threads, but there's a safety element in something that's not permanent. But if we go into the second type of thread, it's a little longer, or PLLA, poly-L-lactic acid. You know it from Sculptra. Lasts a little longer. It is hydrophobic as well. It doesn't want to attract water like the PDO doesn't, so that's nice. But that we think of lasting anywhere from 6 to 12 months. Builds type 1 and 3 collagen. And they're not as common. I don't see a lot of them, but you start to see them coming in North America now. And they're a good type of thread. I always find them when I'm using them mainly overseas, they're a little slippery, a little more slippery. They don't grab sometimes as much as some of the PDO, but so much goes into that. It's hard to tell because it's also in the design of the thread, not just the material. The next longer lasting one is going to be PCL, polycaprolactone. I see these often in different countries for the nose, the smooth threads that go in the nose. People want the nose to last long. They want a nice, something with a high G prime. Of course, threads do and PCL are. It's a complex formulation that, and it is also found in sutures, that lasts a long period of time. So I often see them in nose threads, but they're used in other forms of threads too, and they work very, very well. They're going to last you longer, like 12 to 18 months. When I'm giving you those time frames, someone might disagree a little bit based on some studies. But in general, those are accepted durations. The shortest acting will be PDO up to PLLA, then PCL. But remember, when something's really long lasting, you may not like it because if you don't like the result, you have to wait a long time for it to get better. Also, when you produce collagen, that collagen stays with you as long as you're healthy and you take care of your body and you're doing your other services. That can last you for 6 months, a year or two. So there is a long-term effect of them, but it is a choice. There are different threads. Understand it's your provider that's providing your threads, giving you the information based on your face, your needs, your prior procedures, and what your desired outcomes and risk tolerances are. Just like filling a glabella. You don't see many people use fillers here in this country because of the risk of blindness. Other countries, they're doing it every day. We don't have the risk tolerance. We find that risk for aesthetics of going blind, 1 in 10,000 to 1 in 100,000 too high. Just like with threads. the tolerance for permanent threads and 50% of people being unhappy just to avoid a facelift isn't tolerated in our society. So you have your own risk tolerances of what you might accept, and your practitioner will dive into that with you. Thanks for joining me. Raji's quick clip on the type of threads. I hope that helped. Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.